Good evening, Mr. Sahawi. I'm Councillor Lorraine Dean, and I'm Westminster Council's lead member for SEND and Adults with Learning Disabilities. I live in the Little Venice ward. I'm extremely pleased to see that those adults with complex underlying health conditions and learning disabilities are now on the priority list for the COVID vaccine. However, there are many children under 16 with complex health needs and disabilities who are likely to be extremely sick if they catch COVID-19. What is the government's guidance on vaccinating this cohort of children with SEND?
Thank you very much. Nadeem, is that something that you can comment on?
Almost all children with COVID-19 have no symptoms or mild disease, and the vaccines have not yet been tested in younger children. The manufacturers are all looking at whether it's adolescents or younger children, but none of the vaccines have yet been licensed. The Joint Committee on Vaccination and Immunization advises that only children at very high risk of catching the virus and serious illness, such as older children with severe neurodisabilities in residential care, should be offered the vaccine at this stage. For those children who are at risk, the JCVI, the Joint Committee on Vaccination and Immunization, advice is that this should be a really carefully discussed individual decision between parents, guardians, and their GP. However, we do not yet have clinical trial data, as I said earlier, to support vaccinating children in large numbers. But the scientific community, the teams who've developed the vaccines, are looking at trials with children. And if they are then approved, of course, we will absolutely then deploy those vaccines.